Hello and welcome, everyone. Today I am with Kate Grant. She's a physical therapist. Welcome, Kate. Thank you for joining me.
No problem.
Awesome. So I'm going to let you go ahead and introduce yourself and tell our listeners a little bit more about your background.
Sure, yeah. So I've been in the physical therapy world for now almost 16 years. I've worked in a variety of kind of settings. I've done inpatient care with cardiovascular teams, transplants, total joint replacements, and then also done outpatient with a variety of kind of working with chronic pain, total joint replacements, return to sports. Just kind of have touched on a lot of points. Not a lot of peds, not a lot of wounds, not a lot of burns. Those are the other areas that I don't cover, but almost anything orthopedic. If you're much over the age of 7, I'm happy to try to work with them. But it's been fun to kind of bebop around. I feel like the different industries and areas of the field and learn a little bit more. But I feel like I've definitely kind of settled into what I like to do, which is I think I end up seeing a little bit more of the complex caseload, I would feel like, of people who maybe have a few things going on and it doesn't all seem like it connects, but working to kind of help figure out how to help them feel like themselves again when maybe some other avenues haven't worked.
Thank you for that. Kate and I met in Next Level Neuro's mentorship program, and she's just super awesome. Going to school at UW La Crosse, like I love physical therapists. So with her background, we hit it off, and I just wanted to bring her on to dig into a little bit more about what brought you to the neuro program. Like, how did you discover the mentorship, or what brought you to it?
Yeah. Well, as I said, I've kind of meandered a little bit in the earlier part of my career, kind of just figuring out what felt like me and where I felt like I was using my talents and skills to the most fluidly. And as I said, kind of getting a little bit more into the complex cases, it kind of feels like you pull one thread and you're like, okay, well, I got that better because I did this correction. But now they have to do that correction, otherwise it keeps coming back. So what thread do I pull next? So they're not dependent on always having to do XYZ procedure every day. And so it kind of kept going down that I've studied some osteopathic principles tied into some orthopedic with sports medicine care. And then I kind of came across applied neurology through that lens of going through some more advanced training. And it just made so much sense to me. And I was like, that is the thing we're missing because what creates movement? Our brain. So if I'm trying to get somebody, physical therapists, we come from a very external perspective, looking at how the body's moving. And we're using a lot of external inputs to say, do this, do this, do this. But the brain doesn't have the language to do this, do this, do this without a lot of manual work or hands-on cues or these things. How's the patient going to be successful at home? So really kind of what it applied neurology to me was like, oh my gosh, it's rewriting the coding to create a better program for movement. And as soon as that kind of like went into my brain, I was like, oh, I have absolutely got to add this in because it's this beautiful combination of now, I mean, true applied neurology coaches, they work from the inside out and it works amazing. I think from my background, the way that I look at how I feel like physical therapy and applied neurology hit is like I'm helping them reprogram from the inside out, but then I'm also using my external techniques. So it's kind of like we're tunneling together to get there faster in the middle. And it's just, yeah, once I started learning, it was really cool. I got introduced to it through one mentorship with Missy Bunch. And then she had Matt Bush on as a guest lecturer, who's the founder of Next Level Neuro with Kathy Mock, as you well know, obviously. And from there, it just kind of went through both of their mentorships and had a great experience that I was like, oh, this is just it's so wonderful. I love it.
Um, yeah, I love how you hit on that. And when I talk to friends who are physical therapists or you know, applied kinesiology
Hmm.
masters or whatever, like friends from back in school, and it's like to me it's so cool because what they do is so foundational in our brain map,
Hmm.
right? And it gets so many wins, but then
Yeah.
it's like what happens for those 20% of people where you're just not getting the wins with them? Like, why aren't they getting the wins? And I see it happen in whether it's a chiropractor's office or a physical therapist's office or any professional, it's like you see those certain people that people are like, yeah, well, and then they tend to kind of be like, well, maybe it's this person that they're not doing what I'm sending them home to do. Right.
Hmm.
And so it's always been fascinating to me between the people who gravitate towards helping kind of that 20% and trying to figure it out, and the people that are just like life is busy and they've learned a lot and they do really good work, so it is what it is.
Yeah.
Um,
I mean, I think in that situation, kind of, I mean, that's what I say when sometimes I get clients who will come to me that are, I'm a second opinion from another therapist. And, I always say, like, that's amazing, all the work that you've done. That's not for nothing. That was really important. And there are many people that need that care to get better. That just wasn't your story, and that's okay. You had to find a provider that also wanted to work on that story with you. And, I think there's room and a breadth in the healthcare world that we need a lot of different type of care because we have a lot of different people, and as you and I know, a lot of different nervous systems that respond to different types of inputs, and that
yeah,
broader sense of healthcare as an input.
yeah. So, it's that proprioception level that we talk about in applied neurology.
Mhm.
And how do you relate that to the healthcare experts in like fascia?
So I think the way that I explain it a lot is, and I mean, even just the concept of fascia has evolved so much in the last 10 to 15 years from what I was taught when I was in my schooling for PT versus what I now know about how dynamic the fascia really is. But just explaining to people how it responds under load and tension and lots of different sensory inputs, but it's one of the fastest responding, well, the nervous system's the fastest responding, but the fascia has neurotransmitters within it, and so just giving that more dynamic perspective, I think that there's more load than foam rolling, really, because foam rolling is not actually changing it. It's just a neurological input that's giving your brain better awareness of that space to allow you more freedom of movement temporarily. Um, so we don't have to necessarily hammer and smash the fascia. There's a lot nicer ways that we can communicate it with it. You just have to learn the language.
Yeah, love that. What was some of your favorite takeaways as you were in the mentorship? Like what really became key points for you to take back to your work?
Yeah, I mean, I do think, you mentioned proprioception, fascia, that whole kind of system. That was definitely the area. I'm glad for my perspective that that's where we started earlier in the mentorship because I was like, oh, this is my language. I get it. I can translate this really well. And it does, I think, move really nicely into physical therapy to be able to explain a lot the concept of a blurry map of an ankle sprain that your brain puts up caution tape around that ankle sprain and says, let's use these compensations because that area is damaged and we don't want to mess with it right now. But if you never go back and take the caution tape down, your brain starts to get a blurry spot in its map of how to coordinate your body. And so doing those proprioception exercises reteaches the body how to build that map back out so you have a better efficient map, a non-pixelated map that you can trust when you're driving down the road metaphorically. And so it's not that I didn't do range of motion drills or things like that before, but there's a very different intention. And then taking that basic foundation of like mechanical movements and then adding, well, but what if we did some other like sensory inputs like vibration? What if we did hot and cold? Which has been fascinating to watch how sometimes with patients, certain inputs I would in traditionally have thought would have been the thing they needed some sharp pinpricks, and that's what really calmed their nervous system down. Versus, a bunch of other different techniques. And so learning then to stack that sensory work. But yeah, I think the biggest context that I've taken away and how I frame it is everything that we're doing is working to improve your brain's map. And if we can get your brain's map better, you have better body directions for where you're going. And so as I learned more, that became okay, yeah, proprioception, sensory inputs, but then it was also, well, but my vision. And if you've got a blind spot a little bit in here where you don't coordinate very well, you're going to move your head around to try to figure that out, and that could be causing some of your neck pain. So learning to feel confident in what the visual system looks like, taking that to the vestibular. So it's just been this like I think throughout the mentorship, this like really nice progression as we move through. I mean, some weeks are like, a fire hose of information that I'm going to need to review 5 times, but it's still the general ideas that we're taking for how to use neuroanatomy, which is what applied neurology is. It's just taking the function of anatomy and using it for how the body moves instead of just thinking of muscles and joints, which is where so much of the orthopedic world lives.
Uh, Getting into the brain regions and starting to think through about it from the brain perspective.
Mm.
Wh- what were your takeaways in terms of, getting to know the pons and the medulla and the PMRF and the applied neurology,
Like the
just
neurogate
general?
analysis kind of stuff, you mean?
Yeah.
Yeah, so that was actually the guest lecture on Missy's mentorship was Matt did the neurogate analysis, and that was a lecture that was available, and that's what sold me that I was like, oh, this is what I need to learn. Because so many things that I see in gait patterns of why do these people have these turnouts? They have this shoulder rotation that they're doing. It all of a sudden, instead of being like, there's other systems out there that have some concepts of the neurological system and fascia and different things that work really well for some of my coworkers, and I love that for them, and they get good results with it. It never translated in how my brain worked. This just going straight to the anatomy versus building a system just made sense. So I think having those integrations, it takes those orthopedic problems and gives me a different way to attach other than just say, well, just stop rolling your shoulder and hold your chest, be open, just have better posture. Well, if we could just have better posture, we would have better posture. There needs to be other loading that's happening, and you can strengthen all day, but if your brain's not giving you that input to use it differently, you're still going to revert back to your safety measures when life gets complex or you're stressed, or you're not, I don't know, just in a harder situation.
Yeah, life is always being thrown at us, so we're constantly taking in the inputs,
Yeah.
right?
And I think it's less stressful for patients too, instead of saying in some instances, people still enjoy when I give them posture corrections and like, how do we stack up for the plumb line so, your center of gravity is improved. But then I give them the encouragement and education. And a lot of my patients, I think, because they've been through some other hoops, they like to learn a lot. So that's probably a great niche because I like to teach a lot. But is the idea of saying, why the brain is having you hold this pattern? I think for some people, honestly, kind of freeing instead of just being like, I'm lazy. I just need to sit better. I need to sit better. Instead of being like, well, you remember that car accident that you had and that whiplash event that you had, and then how that that pulls on your brainstem and causes XYZ pattern. So let's rehab basically an old injury of yours to help your posture get better. And I think that's really freeing for some people, honestly.
What do you think of you know, I mean, I guess in physical therapy, you often send people home with homework.
Hmm.
So, like when you're sending people home with neuro drills, does that translate really easily with how you're
Yeah.
working with people?
I mean, me giving the drills, me writing out my weird, instructions and handouts customized for each person, that's fine, But what most of my clients will tell me, and I've had some clients I've, worked with intermittently throughout their lives. So, they've known me for a long time. And they'll laugh and say, like, I don't know why they're easier drills, but I have a harder time doing them. And I think it's just because the entry level is so low. It's easy to kind of like assume that you'll do it and just forget. So what I find is people honestly have the hardest time remembering to implement. So my flow, what I've found typically is what happens, and I'm trying to streamline this, but it still usually takes 2 visits. We do the assessment, we find some drills, we get going. They're excited, I'm excited. They come back and they're like, hey, life was busy. And actually, I only did them like 3 times, which is cool. Like, awesome that you did them 3 times. But neuroplastic changes, as we know, requires a higher frequency and a little bit more time frame. And they're just like, I just forgot, And so we do habit stacking of like, okay, your coffee's brewing. What do we do when your coffee's brewing? Okay, I need you to see your coffee pot. I need you to do your drill and like help them kind of visualize, go through some different times where they get it done. And once we really like think through their life, which requires people to be open and wanting me to be nosy, but asking about their life and finding out, okay, well, this is where I think you could do this pocket. You got a long commute. Stoplights are great for near far exercises. Like you've got 20 seconds, you can get in 3 reps as long as, obviously their vision is safe. Please don't be dizzy afterwards, but um, that's, I think, the weirdest transition is just that these drills are so easy and can be really impactful, but they're really hard to remember at the same time for whatever reason, just because I think they're so easy.
Yeah, it's the behavior change aspect of it, which is about when any of us want any type of result, there's got to be some level of behavior change.
Hmm.
So and we know, like you said, that when we stack it more often and we get more of those inputs more frequently, then the faster we're going to be able to create that change or make something show up better. Um, so it is an interesting thing that happens for sure. Um, what else has really like kind of blown your mind, I guess? Like, has there been anything that
Yeah, I mean, I've had
oh,
some cases that are just, they're really interesting. That I feel like from an orthopedic perspective of like I have a woman who has hypermobility syndrome. And she just came in with just the complaint of, I mean, she's healthy. It's on the spectrum, it's probably a little more mild. But she's very stretchy everywhere. And so she was like, my shoulder just feels like it never lives in the right area. And I have seen her for her shoulder in her past, and she's like, and it got better and it felt okay. We had to do XYZ strengthening, stabilization, hands-on XYZ PT special. And it worked okay. But she came back again. I was like, would you mind if I tried some different stuff in addition to the normal? She was like, yeah, totally. Like, I'm in. And within one session, just like we did, I think I'm trying to remember what it was. I think it was we did vision with her and a VOR, and all of a sudden just like, and that's not even brainstem stuff, which should be the thing that pulls the shoulder back. But she was like, I just don't feel like all this pressure and tension in there. Oh yeah, and that's what it was. And so we did those because she was having a headache that day. And then we did a right stabilization for her right PMRF, and like her shoulder pain was gone. She was fine just from doing that. And yes, technically that's a closed chain exercise in physical therapy world, but it's also the brainstem input. And then what was fun was at the end, she said, actually, I was supposed to go to a chiropractor today because my hip has been bugging me and I've been overdue for an appointment, but I don't have any hip pain anymore. Between the VOR drills and the brainstem stack that we did, she felt fine. And it's just, it took 15 minutes to go through those drills and find her specialties or her high payoffs. And it was just a big change. And so it was fun, not to say that she shouldn't still go see any other practitioner that makes her body feel her best, but just to give her, here's your power. You can do it. I think was really impactful for her. And just because I had treated her for the same thing before and she got better both times, but one was much faster. Um, and then she had more confidence to do the strengthening versus being scared to kind of work up through the strengthening protocol with some hypermobility stuff. And that was pretty cool.
yeah, that's really cool. Especially that confidence builder to know like, oh, if I do a few of these drills, then I feel safer doing this
Mm.
bigger work that I want to do.
Yeah.
That's like the setup to it. And I mean, cranial nerve 8 and the vision drills with the VOR, you're still hitting into the
Yeah, we're still
and
getting
you're
it.
still hitting into the
It's all
brainstem.
connected.
Ah, it is. I love it. Well, thank you so much. I just appreciate you coming on here and sharing some of your knowledge and experience with the program and being from the physical therapist world of, kind of championing um, this type of work, I guess. I mean, one of the things that just really hits me is how individualized it is. Like you're really just looking at the individual in front of you and looking back in their history and trying to figure out, which is going to be these little pieces that bring it all together.
Hmm.
Um, and so, I mean, do you feel like more people, because we do need the people with the specialties to know this type of work, right? So, I mean, is there specific types of people that you really think that this applied neurology thing is for, that they should check this out?
Yeah, I mean, I think definitely more people should check it out just because I think it's a really beautiful way to look at the body. As we joked at the beginning, not everybody needs every type of specialty. And I think more people could come into this arena. But I would say the people who would want to be in this arena are people who really like a puzzle, people who are open-minded to the idea of how maybe a fact or a history point that doesn't seem connected could be woven together. Um, and I think, yes, people with patience just to kind of expand out their worldview, because I definitely still use all of my physical therapy techniques. My toolbox is so much bigger. So, I mean, I do think physical therapists would be great with it. I know athletic trainers use it. I could see chiropractors really loving it as well, just as a nice complement to what they're doing. And I know some chiropractors who do this type of work. That's kind of my world. So that's where I'm like, yeah, I think these people would be great. But I am sure I had a client who was a mental health coach or a mental health therapist, excuse me. And she was like, "Oh my gosh." She was just visiting a friend. It came for a one session with me. But she was like, I wish we lived in the same town. Like, oh my gosh, I'd open up a business and we would work together to work on this. Which I thought was interesting because I come from a very medical orthopedic world. And she said how many people, from that she works with who go through trauma who can use this physical grounding to come into that. And so I don't know a lot of, I know we have mindset coaches and, other professionals within the applied neurology that I've met, but I'd love to see maybe even some more mental health counselors be able to have this as some physical actions too. I don't know. It's an interesting idea to think of. I think everybody is the short answer.
Well, yeah, I mean I love that you touched on that because I mean that's NSI,
Mhm,
Neurosomatic Intelligence is another program that Matt teaches, right?
mhm,
And it really is just a lot of the same ways of thinking about it. It's just a kind of a different niche from a physical perspective versus an emotional perspective.
mhm. Yeah.
Um, and some people you just got, I mean, I was with the Brimhall, Dr. Brett today, and he's really talking about that aspect of it. Like sometimes a person needs to start with their emotions. And he's like,
Mhm,
and other times I really need to start with getting person moving their body and doing things in their body. And he's
mhm.
like, and that's kind of what makes our perspective, individualized. And I was like, and that's one of the things I love about what you do,
Yeah.
right? Like,
Yeah.
so interesting that here I am later today talking about the emotions and the body part of it.
Mhm.
But yeah, definitely, and that's been more of my personal experience was kind of understanding these drills more from an emotional perspective than necessarily a physical performance perspective.
Yeah.
Because I'm more of like, how can I focus and get work done versus I'm not doing as much physical performance as an athlete is.
Mhm.
I just think I'm an athlete.
Well, I think that's been fun though for like, I mean, when you and I have worked together throughout some of the mentorship is, you know, I think we all at this point know that I come in with a big old excited medical nerd model that I'm ready to talk about all these things and noodle through it from my angle, but it's really refreshing. I think to have your perspective, and some of our other classmates that have different backgrounds. Because while I definitely think applied neurology is entirely needed within the physical therapy and healthcare world, I don't think it's exclusionary, to that I think it's really powerful for a lot of people. And I think the cool thing is just how do people use it in their special gift that they already have that, they're already doing out in the universe, right?
Hmm. And from my perspective, that's one of the reasons I love to empower people with it, is because
Hmm.
then it's like, what type of professional do you need, right? Like once you start to get know your body with the applied neurology aspect of it, then you can find somebody locally who really is going to help you build that brain map.
Hmm.
But building that brain map all on your own without somebody sometimes could be a little more challenging.
Hmm. Yeah. Yeah, for
So,
sure.
yeah. Awesome. Well, thank you so much, Kate, for coming on. I really appreciate you sharing.
Yeah. Thanks for asking, Joe.